May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Luknete Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. I welcome all of you in this lecture 5 of antibiotic. So in this lecture, we will cover aminoglycoside antibiotic. Learning outcome. After completion of this topic, a student able to understand the chemistry and structural activity relationship of aminoglycoside, understand the inactivation of aminoglycoside, and remember the uses of aminoglycoside. So aminoglycoside, the streptomycin is the first aminoglycoside from genus Streptomyces among many antibiotic isolated from this genus. Several compounds closely related to structure of streptomycin. 6 of them are Kanamycin, Neomycin, Paramomycin, Gentamicin, Netilmicin, and Amikacin. So these are the examples of important aminoglycoside. All aminoglycoside are absorbed very poorly following oral administration, and some of them are administered by that route for treatment of GIT infection. Because of their potent broad spectrum antimicrobial activity, they are also used for treatment of systemic infection, but their undesirable side effect, particularly ototoxicity and nephrotoxicity, have restricted their systemic use to serious infection. The aminoglycoside given by parenterally, by intramuscular, or sometime intravascular or intravenous. Chemistry. Aminoglycoside are named because their structure consists of amino sugar linked glycosidically. All aminoglycoside have at least one amino hexose, means amino group with 6 carbon carbohydrate, and some have pentose 5-member ring lacking amino group like streptomycin, neomycin, and paramomycin. Additionally, each of clinically useful aminoglycoside contain highly substituted 1,3-diaminocyclohexane central ring. So in case of chemistry, all aminoglycoside, because it contain amino sugar, at least one amino hexose sugar is present, and some have pentose 5-member ring lacking amino sugar like streptomycin, neomycin, and paramomycin. In addition, they also contain substituted 1,3-diaminocyclohexane central ring. So here there are two types of this cyclohexane ring. First one is called as 2-deoxystreptamine, this one 2-deoxystreptamine. So here example is Kanamycin, Neomycin, and Gentamicin. So in this aminoglycoside, the central ring is 2-deoxystreptamine. 2-deoxy means on second position there is the absence of hydroxyl group. So here it is second position. So there is no hydroxyl group, therefore it is called as 2-deoxystreptamine. Another type of ring, cyclohexane ring, is called as streptidine, this one. Example is streptomycin. So streptomycin contains this streptidine ring as a central ring. So it is the two type of cyclohexane ring. Then first aminoglycoside, that is Kanamycin. So it is a structure of Kanamycin. So if you see here the structure, Kanamycin is a mixture of Kanamycin A, B, and C. So these are the 3 rings of Kanamycin. So this ring, central ring, it is a deoxystreptamine, as we seen here previously. There is a deoxystreptamine central ring. Then this lower ring is canosamine, it is a canosamine, and this one is a amino sugar. So here is a mixture of kanamycin A, B, C. The difference of A, B, C is this R1 and R2. So here is R1, this one is R2. So in case of kanamycin A, R1 equal to amino group, that is NH2 group, R2 equal to hydroxyl group. In case of kanamycin B, R1 equal to NH2 group, R2 equal to again NH2 group. Kanamycin C, R1 equal to hydroxyl group and R2 equal to NH2 group. If we see the SAR here, so in case of ring 1, so it is a ring 1, above there is a first ring, that is a ring 1. The point is, first point, amine function at carbon 6 dash. Here numbering pattern is important, so you should remember the numbering, how it is given the number. So here is central ring. First see the central ring. Simple number is given 1, 2, 3, 4, 5 and 6. So as shown in this structure, central ring is given 1, 2, 3, 4, 5, 6. Above ring given the number 1 dash, 2 dash, 3 dash, 4 dash, 5 and dash and 6 dash. Lower ring numbering is given like 1 double dash, 2 double dash, 3 double dash, 4 double dash, 5 double dash. Now see the SAR. First point, amine function at carbon 6 dash. So 6 dash means this one is 6 dash. And C2 dash means this one is R2. So it is a here, there is a C6 dash and there is a C6 dash here and there is a R2, that is R2 dash. So particularly important, so here amine function is important on this position, that is carbon 6 dash and carbon 2 dash. Amine function is important. Therefore, kanamycin B is more active than kanamycin B is more active than kanamycin A and then kanamycin C. So if we see the kanamycin B structure where R1 and R2 equal to amino group. So in case of kanamycin B, it contains 2 amino group, that is on carbon 6 dash and carbon 2 dash. Therefore it is more potent as compared to kanamycin A, where R1 equal to NH2 group, R2 equal to OH, that is only 1 amino group is present. In case of kanamycin C, it also contains 1 amino group, but it is on R2 position. So amine function at carbon 6 dash and carbon 2 dash are important. Therefore kanamycin B is more potent than A and then it is more potent than C. Next point, methylation at carbon 6 dash, again same position, methylation at either carbon 6 dash and 6 dash amino group does not lower antibacterial activity and confer resistance to enzyme acetylation of 6 amino group of AAC enzyme. So here again the position, that is carbon 6 dash. So it is carbon 6 dash and amine group, that is when R1 equal to amino group, then there is no lower activity, but it gives the advantage that it is a resistance to enzymatic acetylation of 6 amino group by AAC. So it is an enzyme AAC. AAC means aminoglycoside acetyl transferase. So it is an enzyme. Actually there are 3 enzymes which causes inactivation of kanamycin A. So here the list is given. This one AAC means aminoglycoside acetyl transferase. Then APH, aminoglycoside phosphatidyl transferase. ANT means aminoglycoside nucleotidyl transferase. So here the target of these enzymes are given. For example, AAC, the main target of this enzyme is 6 dash amino group, 3 dash amino group, 3 amino group and 2 dash amino group. So AAC का जो मेन टारगेट है वो अमाइनो ग्रुप है. So the main target of AAC enzyme, that is NH2 group. Similarly, the main target of APH enzyme is 3-hydroxyl group, 2-hydroxyl group. In case of ANT, that is aminoglycoside nucleotidyl transferase, the target is 2-hydroxyl group, 4-hydroxyl group, 4-hydroxyl group. So if point number 2 is that if we do methylation at carbon 6 or amino group is replaced by methyl group, then this enzyme AAC enzyme not attack there. Why? Because the target of this enzyme is NH2 group. If we replace this NH2 group with methylation, then there is no attack of AAC. Similarly, if we protect this amino group by increasing the bulkiness surrounding to that amino group, it also prevent the attack by this AAC enzyme. So here the simple approach is used to protect the drug from the inactivating enzyme is that either you remove the targeted group or protect this targeted group by attaching the bulkiness surround to that target. So here methylation, if we do the methylation at carbon 6, then this methylation protect the amino group on 6th position by AAC. Similarly, if amino group is replaced by methyl group, then there is no attack of AAC. Third point, removal of 3- and 4-hydroxyl group or both in kanamycin does not reduce antibacterial activity. So if you remove 3- and 4-hydroxyl group, so here this group 3- and 4-hydroxyl group, if we remove this, antibacterial activity not decreases. Next point, the carbon 1 amino group of ring 2 of kanamycin A can be acetylated without loss of activity. Example is amikacin. So here amino group at carbon 1, so it is a amino group at carbon 1. So if we replace or we causes acetylation of this NH2 group of deoxystreptamine ring of kanamycin A, remember here kanamycin A का स्ट्रक्चर में जो सेंट्रल रिंग है that is called as deoxystreptamine, उसमें जो NH2 ग्रुप है अगर हम वहाँ पर एसिटिलेशन करते हैं, so it gives the new compound called as amikacin. So structure of amikacin is this one. So here you see this is the first position. So here there is a acetylation by amino hydroxybutyric acid. So here there is a acetylation of NH2 group of kanamycin A by the amino hydroxybutyric acid. So here only one hydrogen of NH2 group is replaced by amino hydroxybutyric acid, and this compound is called as amikacin. So this amikacin, which is a amikacin, that is N-amino alpha hydroxybutyric kanamycin A, is a semi-synthetic aminoglycoside. The synthesis involved simple acetylation of primary amine group of deoxystreptamine ring of kanamycin A with amino hydroxybutyric acid. This amino hydroxybutyric acid derivative is much more active than the D isomer. So here the hydroxybutyric acid, when we use capital L type of amino hydroxybutyric acid, then it gives a more compound as compared to D isomer. The important feature of amikacin is that it resists the attack by most bacterial inactivating enzyme, and therefore it is effective against the bacteria that are resistant to other aminoglycoside. So it is a new aminoglycoside amikacin obtained from the kanamycin A after the acetylation. So these amikacin show the resistance against most of the inactivating enzyme. Uses: kanamycin use is restricted to infection of intestinal tract and to systemic infection arising from gram-negative bacilli. that have developed resistance to other antibiotic. It has been recommended for pre-operative antisepsis of bowel. It is absorbed poorly from intestinal tract. Systemic infection must be treated by intramuscular or intravenous injection. These injections are rather painful and concomitant use of local anesthetic is indicated. Use of kanamycin in treatment of TB has not been widely adopted since mycobacteria develop a resistance very rapidly. Kanamycin may cause decrease or complete loss of hearing, that is ototoxicity. So the main side effect of this aminoglycoside is ototoxicity and nephrotoxicity. So it is the first aminoglycoside, that is kanamycin. Second aminoglycoside, that is gentamicin. So here is a structure of gentamicin. So here there is again central ring, then above ring and below ring. So here the numbering pattern is same. In case of above ring, the numbering is 1 dash 2 dash. So this ring, that is 1 dash 2 dash 3 dash 4 dash 5 6 dash. Similarly, below ring, that is called as 1 double dash 2 double dash, like numbering is given. So here again there is a SAR. So here again there is a gentamicin is a mixture of three type of compound, that is gentamicin C1, gentamicin C1A and gentamicin C2. So it is a combination of these three. So what is the difference between gentamicin C1, 1A and 2? So here again there is a R1 and R2. So here R1 and R2. So in case of gentamicin C1, R1 equal to methyl group, R2 equal to hydrogen, and this R3. So here is a R3. So R3 equal to CH3. In case of C1A, all R1, R2, R3 equal to H. In case of gentamicin C2, R1 equal to H, R2 equal to H, R3 equal to CH3. Now the SAR methylation, again point is same as previous. Methylation of carbon 6 dash or 6 dash amino group does not alter antibacterial activity but increase the resistance against AAC enzyme. Therefore, gentamicin C1 is more resistant to gentamicin C2. So it is same point. The AAC enzyme, the target of AAC enzyme is NH2 group. So if we replace this NH2 group by methylation, or if we provide the protection to this NH2 group by increasing the bulkiness, the AAC enzyme not attack on NH2 group. So here methylation, if we do the methylation at carbon 6 dash or 6 dash amino group, then the activity is not decreases but it shows the resistance against the AAC enzyme. Therefore, if we see gentamicin C1, which contain 2 methyl group, is more potent because it provides the protection to the amino group. So there is a in bulkiness is more. So R1 R3 equal to CH3 group in case of gentamicin C1. So it gives the protection. So therefore gentamicin C1 is more resistant to gentamicin C2 because it only contain hydrogen at R1 and R2 position and R3 CH3 group. Second point, 2 double dash deoxy gentamicin are less active than 2 double dash hydroxy gentamicin, but 2 double dash amino derivative are inactive. So point number 2 is 2 double dash deoxy. So here 2 double dash deoxy means this hydroxyl group is called as 2 double dash. Below ring attachment, that is 1, then it is 2 double dash, then this 2 here is 3 double dash. So here the point is 2 double dash deoxy gentamicin means if we remove this hydroxyl group, then the compound is less active as compared to the compound which contain hydroxyl group on 2 double dash position. If we replace this hydroxyl group of 2 double dash position with amino group, then the compound is active. Next point, third one, 3 double dash NH2 group may be primary or secondary. So it is a 3 double dash So here is a secondary amino group. So it may be primary. Primary means it may be NH2 or it may be secondary, as here NHCH3 group. So both are important, primary as well as secondary. Next point, 4 double dash hydroxyl group. This one, 4 double dash hydroxyl group can be axial. So here this hydroxyl group is in axial position. If we change this hydroxyl group position to equatorial, then it is easily attacked by ANT enzyme, that is aminoglycoside nucleotidyl transferase enzyme. So this hydroxyl group here is in axial position, therefore this ANT enzyme not attack here. But this hydroxyl group, if this hydroxyl group is in equatorial position, there is a chances of attack of ANT. Next point, lack of 3 dash hydroxyl group favor resistance against APH. So 3 dash hydroxyl group means here this one, simple 3 dash hydroxyl group, so here 3 dash hydroxyl group means favor the resistance against, so lack of 3 dash hydroxyl group. So here there is a no hydroxyl group, as in case of kanamycin here is a hydroxyl group, but here there is a no hydroxyl group on 3 dash position, therefore it show resistance against the APH enzyme. So it is the main SAR point of gentamicin uses. It is effective in treatment of various skin infection for which topical cream or ointment may be used, because it often no real advantage over the topical neomycin in treatment of all but pseudomonas infection. However, it is recommended that topical gentamicin be reserved for used in such infection and also used in treatment of burn complicated by pseudomonas. So it is the main uses of gentamicin. Next drug is, there are 2 drugs, Sizomicin and Netilmicin. So here the structure is Sizomicin. This one is Sizomicin structure. In case of, this structure is of Netilmicin. It is a Netilmicin structure. In case of Sizomicin, this become NH2. So here, when here there is a NH2, then this structure is called as Sizomicin. But here there is a ethyl group, then it is called as a Netilmicin. So it also contains the ring deoxystreptamine, dihydropurpurocin and garosamine. Now SAR, omitting 3 4 hydroxyl group and addition of double bond between carbon 4 and carbon 5 does not affect antibacterial activity but increase resistance against the ANT and APH. So in case of kanamycin, there is a hydroxyl group on these 2 positions. Here there is a hydroxyl group, but here there is a double bond. So if we remove 3 and 4 hydroxyl group, which is present in mainly kanamycin, but here there is no this hydroxyl group in case of Sizomicin and Netilmicin, and there is a double bond between carbon 4 and carbon 5 does not affect the activity but increase the resistance against ANT and APH. So this ANT and APH enzyme, the main target is hydroxyl group, but here there is a no hydroxyl group on this position, therefore this drug show the resistance against ANT and APH. Next point, 1 amino ethylation of Sizomicin save antibacterial activity and increase enzymatic resistance. Example is Netilmicin. So if this group is NH2, then it is called as Sizomicin. But if we do the ethylation of this NH2 group of Sizomicin, then it gives the drug that is Netilmicin. So it is a Netilmicin. So it is about the Sizomicin and Netilmicin. Next drug is Neomycin. Next aminoglycoside, Neomycin. So it is again combination of Neomycin A, Neomycin B and Neomycin C. So it is a combination of these 3, A, B, C. So here the structure of Neomycin B. So this structure is Neomycin B structure. So this structure consists of 3 to 4 ring, First ring is called as Neomycin C. So this ring is Neomycin C. Second ring is called as deoxystreptamine ring. Third ring is that is pentose sugar ribose. And last ring is that is Neomycin B. So these are the four rings which make the Neomycin B structure. So this structure is of Neomycin B. So Neomycin B consists of four rings. First ring is Neomycin C. Second ring is deoxystreptamine. Third ring is ribose. Fourth ring is Neomycin B. Now Neomycin A is obtained by breaking of bond between deoxystreptamine and ribose. So if we break this bond, see here, if we break this bond between the deoxystreptamine and ribose, then it gives the structure of Neomycin A. This one is Neomycin A. So Neomycin A is a combination of these first two rings. So Neomycin A is a combination of first two rings, that is Neomycin C plus deoxystreptamine. So in short, Neomycin A is obtained by breaking of bond between deoxystreptamine and ribose. In short, Neomycin A consists of two rings, that is Neomycin C plus deoxystreptamine. Now the structure of Neomycin C. So here in case of Neomycin C, only difference is this group, that is called as CH2NH2 group. In case of Neomycin C, this group is above the plane. Means if we see here, it is a structure of Neomycin B. Here is dotted line is given, means below the plane. So alpha position is called as alpha position. So in case of Neomycin B, this CH2NH2 group is attached by the dotted bond, and this ring is called as Neomycin B. But in case of Neomycin C, same group is attached but beta position, when that is solid line. If we convert this dotted line into solid line, then this ring is called as Neomycin C and the compound is called as Neomycin C. So in short, the difference between Neomycin B and Neomycin C is that the last ring, in case of Neomycin B, the last ring is Neomycin B, but in case of Neomycin C, the last ring is Neomycin C. So only the difference is bond. So when there is a dotted bond, that is called as below the plane, then it is a structure of Neomycin B. If we just convert this dotted bond into dark bond, that is on above the plane or beta position, then this structure is called as Neomycin C. So Neomycin A, B and C. So Neomycin A means only above two ring, that is Neomycin C plus deoxystreptamine, and this structure is Neomycin B. And in case of Neomycin C, only the difference is this bond, if we convert into solid bond, that is above the plane or in beta position, then this structure is Neomycin C. Uses: it is most useful antibiotic for treatment of GIT infection. Dermatological infection, also used in abdominal surgery to reduce or avoid complication caused by infection from bacterial flora of bowel. So it is the main uses of Neomycin. Next is Paramomycin. Again it is a combination of two, Paramomycin 1, Paramomycin 2. Here Paramomycin 1, Paramomycin 2. See the structure difference between Paramomycin 1 and Neomycin B. So Paramomycin structure is same structure of neomycin, but only one structural difference. So here we compare Paramomycin 1 to Neomycin B. So in case of Neomycin B, this group is CH2NH2. In case of Neomycin B, this group is CH2NH2 here. This. So in case of Neomycin B, this group is CH2NH2. But here, in case of Paramomycin 1, this group is CH2OH. So Paramomycin 1 is having the same structure with Neomycin B, except that above ring contains CH2OH group instead of CH2NH2 group. Similarly, Paramomycin 2 having the structural similarity with Neomycin C. Instead of CH2NH2 group, it consists of CH2OH. In short, Paramomycin 1 equal to Neomycin B, Paramomycin 2 equal to Neomycin C, except the above group. Paramomycin 1 and 2 contain CH2OH group, but in case of Neomycin, there is a NH2OH group. Uses: these drugs are used in GIT infection caused by Salmonella and Shigella and E. coli. So it is the main usage of this compound. Now the last drug is Streptomycin. So it is a structure of Streptomycin. So this drug contain 3 rings. First above ring is called as streptidin, central ring is streptose, and below ring is N-methylglucosamine. So here there is a SAR point. This drug we already cover in anti-tuberculosis. So same SAR here is also. So here the first SAR point, L-streptose, that is about this ring. First SAR is related to this ring and related to this CHO group, that is aldehydic group. So here there is a CHO group, that is aldehydic group. So first point in SAR is reduction of this aldehydic group to alcohol result in compound which is nearly same activity but greater potential for producing deafness, that is ototoxicity. So if we reduce this aldehydic group into alcoholic group, activity nearly same, but the toxic effect is, chances of toxic effect is more. Second point, similarly, if oxidation of this aldehydic group into carboxylic group or conversion of this aldehydic group into oxime semicarbamazone result in inactive compound. So it is the 2 point related to this CHO group. So if this CHO group is reduced to alcohol, there is a more chances of side effect. If we oxidize this CHO into COOH group, then compound is inactive. Third point is related to, that is methyl group, then this methyl group. So it is a CH3 group. So third point, oxidation of this methyl group in CH2OH group give the active analog, but there is no advantage over the streptomycin. Fourth point, next point, modification of amino methyl group. This one. Now regarding this, modification of amino methyl group in glucosamine by demethylation or by replacement with larger alkyl group reduce the activity. So if we causes demethylation of this group, means removal of this CH3 group, activities decreases. And if we replace this CH3 group with bulky group, again activities decreases. Next point, removal or modification of guanidino group. So it is a guanidino group. Abhorring guanidino group. This one is also guanidino group. So removal or modification of guanidino group result in decrease the activity. So it is the main SAR points. Again I repeat, first point, reduction of aldehydic group to alcohol result in compound which is nearly same activity but more chances of producing side effect, that is deafness, ototoxicity. Point number 2, oxidation of aldehydic group to carboxylic group or conversion into oxime semicarbamazone result in inactive compound. Third point, oxidation of methyl group to CH2OH group give active analog but no advantage over the streptomycin. Next, modification of amino methyl group by demethylation or replacement with larger alkyl group reduce the activity. Next point, removal of modification of guanidino group result in decrease the activity. Now there is an inactivation of Kanamycin B. So as previously there is we discussed about the enzyme which is responsible for inactivation of aminoglycoside. So here there are three enzymes, that is AAC, that is aminoglycoside acetyl transferase. Second one is APH, aminoglycoside phosphotransferase, ANT, aminoglycoside nucleotidyl transferase, and the target is given here. In case of AAC, the main target is 6' amino group, 3 amino group, second dash NH2 group. The target of APH is 3' hydroxyl group, 2 double dash hydroxyl group. Target for ANT is 2 double dash hydroxyl group, 4 dash hydroxyl group, 4 double dash hydroxyl group. So here the simple technique is used to prevent the drug from this enzyme. First technique is, whatever the target of that enzyme, if we replace this target with another group. For example, the target of AAC is amino group. If we replace the amino group with any other group, then this enzyme not attack to that drug. The first approach. Second approach, by supplying the or by putting the bulkinase or by increasing the bulkinase around the target group. So suppose for example, if NH2 is the target, if we put the bulkinase or if we put the bulky group just neighbor to NH2 group, then it gives the protection to amino group. So it is the two main approaches used to protect the drug. So accordingly, first point, gentamicin. In case of gentamicin, we discussed previously, gentamicin which does not contain 3' hydroxyl group in ring 1 and therefore not inactivated by APH. So as we know, the target of APH is 3' hydroxyl group. So here there is no hydroxyl group. So either you remove the target group or you can replace this target group with another group. So here there is a lack of 3 hydroxyl group in case of gentamicin. Therefore this drug is not inactivated by APH, but it is phosphorylated same group in kanamycin. So APH attack the kanamycin because it contains 3' hydroxyl group, but in case of gentamicin it does not contain 3' hydroxyl group, therefore it shows resistance against the APH enzyme. Point number 2, gentamicin C1 but not C2 and C3 is resistant to AAC that acylate 6' amino group in ring 1 of kanamycin B. So again, AAC enzyme, the target is NH2 group, but in case of gentamicin there is no NH2 group on this position, therefore it is not attacked by this AAC. Third point, all gentamicin are resistant to ANT that adenylate secondary equatorial 4' hydroxyl group of kanamycin because it is tertiary and axially oriented. So in case of gentamicin, we already seen 4' hydroxyl group present axially, means the position of hydroxyl group on 4' position in gentamicin is axially oriented. If we change the position from axial to equatorial, then it is easily attacked by ANT enzyme. But in all gentamicin, this hydroxyl group of 4' position present oriented axially, therefore there is no attack of ANT. Next point, kanamycin derivative amikacin, which is a new drug which is resistant to known inactivating enzyme except ANT that adenylate 4' hydroxyl group of ring 1. The introduction of L-amino hydroxybutyric acid, AHBA means amino hydroxybutyric acid, in kanamycin A decrease its affinity for inactivating enzyme. So in case of SAR, we already discussed this point. Amikacin is formed by the acetylation of kanamycin A with this AHBA, and it gives the drug amikacin, which is show the more resistance against this enzyme. So it is about the all aminoglycoside. So if you like the video, then subscribe the channel. Thank you very much.